Pornography and sex disorders encompass a range of psychological conditions related to unhealthy and compulsive sexual behavior and the consumption of pornography. Those disorders can have significant negative impacts on individuals' personal relationships, mental health, and overall well-being. It is important to note that the classification and diagnosis of specific disorders in this area are still evolving, and not all professionals might agree on the terminology or criteria used to define those conditions. Pornography addiction, compulsive pornography use is characterized by an intense and uncontrollable need to consume pornography, often leading to negative consequences in various areas of life. Individuals with this disorder might spend excessive amount of time viewing pornography, neglecting responsibility, and experiencing difficulty in controlling or stopping their behavior. Hypersexuality, sexual addiction. Hypersexuality, also known as sexual addiction or compulsive sexual behavior, involves excessive preoccupation with sexual thoughts, fantasies, or activities. People with this disorder might engage in risky sexual behaviors, have multiple sexual partners, or spend significant time and resources on sexual activities. They might also experience distress, impairment functioning, or negative consequences as a result of their behavior. Obsessive thought refers to intrusive or distressing sexual fantasies used images significant impact on the individual's daily life. Those sexual might be unwanted, persistent, or difficult to control, leading to distress, anxiety, interference with daily functioning. Paraphilic disorder. Paraphilic disorder involves atypical or unconventional sexual interests or fantasies that cause distress or harm to oneself or others. Examples include exhibitionism, voyeurism, pedophilic disorder, or fetishist disorder. Those disorders can have intense, persistent urges and the person. Their treatment to this disorder typically involve a combination of therapy, support groups, and sometimes medication. Those common therapeutic approaches include cognitive behavioral therapy, that helps the individual to identify or change distorted thought, belief related to their sexual behaviors, and developing healthy coping mechanisms to learn strategies to impulse the control. Relapse prevention. Individuals are taught strategies to recognize triggers and develop a skill to prevent relapse into problematic or compulsive sexual behaviors. Group therapy or support groups. Participating in group therapy or support groups can provide individuals with sense of community, understanding, and accountability. It can offer platform to sharing experiences and learn from others who have similar struggles. Medication. In certain cases, medication can be prescribed to help manage underlying mental health conditions to contribute to the co-occurring problematic sexual behaviors. It is important for individuals experiencing difficulties related to pornography or sex to seek professional help from qualified mental health professionals who specialize in sexual disorders. They can provide acute diagnosis, developing appropriate treatment plans, or offer support or through